you're in the right place. This is the Eatfluencer Podcast, and I'm your host, Dr. Maggie Landis. Together, we are going to unpack everything about eating and discover the what, when, and how that will let you lead your best life. This is not your doctor's conversation about nutrition. Today is when you can start to love eating again. Let food be food and you be you. Get ready to get eatfluenced. Welcome back to the Eatfluencer Podcast. I'm Maggie Landis, your host here, and you are listening to episode 51, Physical Therapy Using a Non-Diet Approach. And I've got a guest today, but let me tell you what, this is so fun to have met her, and I'm really excited to bring you this conversation because, as you've heard me say many times, this diet culture narrative is pervasive. It's pervasive in our media, in our retail, in the food industry, in, the marketing and advertising of basically every single product that's out there. And it is also really pervasive in healthcare. And many of you have told me about your experiences with doctors that were very weight stigmatized and very unfavorable. And we address that a lot on the podcast because it's a really, really serious problem, both for the individual and for health care delivery at large. But it doesn't stop in doctors' offices. And there is a lot of weight stigma and bias around the physical body, and particularly people in large bodies being blamed for a variety of health conditions. And this comes out in physical therapy a lot. And it's an area maybe we don't think about as much as the doctor's office because that just seems more obvious. But when we're talking about the physical body, and particularly with regard to chronic pain, with mobility, things like that physical therapists deal with on a regular basis, it is very easy for them to practice in a diet culture influenced way for all the same reasons that doctors practice in a diet culture influenced way. Their education is biased. The practice environment is not supportive of it. They have, personal biases just from being members of society. But today I want to bring you a really interesting conversation. So Dr. Lisa Folden is a physical therapist, and she runs her practice, manages her patients, and conducts her own life in a non-diet, health at every size model. And I have not met many physical therapists like her. In fact, I'm not sure I've met any. So you're going to love this conversation because we're going to get into really some of the questions that you all always ask me about. Well, what about joint pain? Like, there's no way that it can be good for my knee pain, or that it can't be bad for my back pain or my knee pain that I'm in a large body. But Lisa's going to lay some of that to rest, and in this conversation give you all some great ideas on how to increase your quality of life and your mobility and your physical capacity without falling into that trap of diet culture influence. So let me give you a quick little bio on Dr. Folden, and we'll get into the conversation. So Dr. Lisa Folden is a licensed physical therapist, mom-focused lifestyle coach, and owner of the Healthy Phit Physical Therapy and Wellness Consultants in Charlotte, North Carolina. As a body-positive women's health expert and health at every size ambassador, Dr. Folden assists women seeking a healthier lifestyle by guiding their wellness choices through organization, planning strategies, and holistic goal setting. She is also a mom of 3, a published author, and a speaker who understands the complex needs of the modern busy woman. And one of her passions is to help busy moms find healthy as one of their top priorities. She is a regular contributor to articles on topics related to physical therapy, health, wellness, self-care, body positivity, pregnancy, and she's been featured in a number of publications, including Oprah Magazine, Shape Magazine, and several other local and national publications. She also wants to note that she's a member of the National Association of Black Physical Therapists, the Association of Size Diversity and Health, Alpha Kappa Alpha Sorority, and is an expert panelist for the Her Health Collective. So, welcome, Lisa Folden. So, I'm so glad you're here to join us in this conversation today. Lisa, thank you for coming.
Thank you so much for having me. I'm so excited as well.
Well, you know, you do a lot of very, very cool stuff. But before we get into exactly what you do, I am curious, you know, you're a physical therapist by profession, and working in this health at every size, aligned, weight inclusive manner is not the mainstream for people in your profession. So I'm curious when you decided to do this, or what was the, you know, this is probably bottom line. This is probably not what you learned in school.
No, it is not.
I can say that because it's not what I learned in school either. So I can say that with confidence. Yeah.
Right. So, so I went the traditional route like other physical therapists, and learned kind of all the basic things we all learn when we're medically trained in the United States of America. So the health at every size movement, I didn't find it formally until probably 2019. Prior to that, I tried to operate my practice in a way, at the very least, giving my clients the grace to understand that, you know, focusing on weight and body size and comparing yourself to others is not beneficial or helpful to your progress and to your journey. But if I'm being very honest and transparent, I did not extend that same grace to myself. So
we're so guilty of that. Yeah, you know what? We're so much nicer to other people than we are. We're even nicer to strangers than we are to ourselves.
Absolutely are. So I was trying to treat my clients in a positive, body positive, fat positive way. But I was always trying to lose weight. I didn't really stop trying to lose weight until, I'd probably say mid 2019, when I started to read and learn and really understand the concept of health at every size, and just dove into Dr. Lindo Bacon's books, and then read Intuitive Eating, and just kept, it was kind of like this snowball effect. I got a little bit of knowledge and I was hungry for some more, and I was hungry for some more. And then I was able to adopt a lifestyle where not only, you know, I was treating my patients in this way, but I was treating myself in this way. And then that's when my social media shifted, you know, to focusing, you know, hugely on health at every size and educating people, because like you said, it's not mainstream, and people really need to know. And I catch a lot of slack for it. Usually it's, you know, troll accounts on social media, but I don't care. You know, I'm going to keep fighting the good fight, as I like to say. So I would say that's when it started.
Yeah. And so I know you are intellectual, academic, like you probably are very compelled by evidence. And I'm curious, I'll tell you what was the turning point for me, because I'm very much the same way, was reading the science about the fact that taking on health promoting behaviors improves your health, even if your body does not change size. That was those were the articles I needed to read. And I was like, okay, that seals the deal for me, that really, could bury the idea that smaller is better, smaller is healthier, and really accept the idea that that is a cultural construct, not a scientific principle. And I'm curious if you had a sort of a piece of evidence or a specific thing you learned, because I agree with you, that Health at Every Size book by Dr. Bacon, I mean, that is for anybody to read. But if you're a nerd and you want it, there's like 400 scientific references in the back.
Oh, much research in there. Yes.
Yeah.
For me, the real research was the numbers on how many people could actually intentionally lose weight and keep it off. And it was like, wait, what? It's like, wait, only like less than 5%. And that's maybe because, you know, they haven't really studied like beyond that 5-year range, you know? So it was like, why are we doing this to ourselves? Like, why are we trying to kill ourselves to lose weight and restricting ourselves to no end when 95% of us will never keep this off because it's not necessarily healthy for our bodies, nor what our bodies need. So, and I experienced that. I had that final, like, all right, let me go hard or go home, and worked out 7 days a week and restricted, and lost 20 pounds and woke up like, oh my God, I'm tired. Went back to a normal sort of lifestyle, exercising 4 days a week, eating when I was hungry and feeling good, and gained every pound back plus like 5 more. I was like, this is stupid. Why am I playing this game?
Well, and how many, you are just saying what you represent the story of so many women, particularly, in our age. I don't want to classify you as a middle age, but I think we're middle age, right? We're we're not exactly babies anymore.
Exactly.
But we get stuck. We just really get stuck. And part of that is the belief system about weight and health that we are conditioned by, to be honest, because most people that are listening to this are not you and me. They're not reading PubMed articles. They're not getting PhDs. They're not. So, and that's fine. That's fine.
Yeah.
But I feel like if you're a health professional, you need to be held to like a higher standard of evidence-based practice, because everybody else is relying on it. And that's what really burns me up.
Me too.
So many colleagues that, and I'll be guilty. 10 years ago, I was doing this. 5 years ago, I was doing this.
So was I. Like, you're not alone. And it's the norm. And this is funny. I was actually on a Facebook Live with a personal trainer friend of mine last week. And right before our recording, because we're going to talk about health at every size, he's sort of transitioning into that world. Right before the recording, he said that one of his friends texted him, a former client, who said she was so upset because she had just gotten back from her OBGYN's office. And her doctor, her professional medical doctor, said to her, now, mind you, all her blood work was looking good. She'd been making some great changes to her lifestyle as far as her health goes. And the OBGYN looked at her and said, you really got to lose some weight. You're fat as HELL. And if you don't lose some weight, you're going to be a fat bride. Like, a doctor said this to a patient. I was like, what's her name?
Yeah, like, that is not
infuriating.
Okay. Well, that is extremely explicit fat shaming, but it happens in subtle ways all the time. I mean, it happens in subtle ways. And here's what I want to ask you. So your specialty's in physical therapy, and I get this question just more often than not about, well, isn't it just true that your body will hurt more and you will have more joint pain and you will have less flexibility and all these things if you are, quote, overweight or fat? I mean, they just cannot uncouple the idea. So I'd like you to, how would you approach somebody who has that misconception?
Sure. That's a great question. And yes, that's something that I deal with daily. And I'll be just very honest. In PT school, we simply learned, hey, if you have a lot of joint pain and the patient is overweight, you need to suggest weight loss. Like that will help them. That will help lessen the load. And here's the reality. We talked about this before. Physics exists. There may be more pressure because you weigh more. Absolutely. But here's the reality of that. We all experience pain in different ways. You can see someone with the same identical x-rays, like the exact same damage in their joints. One person is in excruciating pain daily. The other person feels nothing and they're out running. So we all experience that pressure, that force of our body weight in different ways. So no, the short answer is no. Being in a larger body does not mean that you're going to be less flexible or have more pain. Now, you may or you may not, but it's not straight across the board. Being fat, being heavy, being overweight, whatever you classify that is, does not mean that your joints are hurting and that your joints are in danger or that you're suffering in some way. There are people in larger bodies who can run, who can jump, who can do yoga, who can twist their body into contorted positions that I could never,
right.
So it has no actual bearing. And what I like to focus on with those clients is like, let's address this as if weight were never even an issue or a thought. What can we do to improve your range of motion, to lessen your pain, to improve your mobility? It's the same thing I do across the board with all of my clients who have joint pain. We're going to stretch. We're going to exercise. We're going to work on stability training. We're going to educate you on posture and other things of that nature, because you can find improvement without changing the size of your body. And like you and I discussed earlier, like it doesn't work for the vast majority of people. So prescribing weight loss is really pointless. It really is. It's just, let's do things that are going to make you stronger and healthier. If your weight changes, fine. If it doesn't, fine. But overall, we can get you to feel better. And that's what I want more physical therapists to understand. I consider myself a fat friendly PT, and I want more therapists to understand that when we're working, with clients in larger bodies, because I've had at least 5 clients just this year alone come to me and tell me of traumatic stories in doctor's office or with personal trainers or physical therapists. And it's just heartbreaking. And they just want to be seen. They want to be treated like everybody else and given the same options. So
yeah,
really
exactly.
important.
Well, and what I see the real tragedy in it, I have a public health background, is that, I mean, that's awful for those individual people, but the big picture is that some of them don't go back. They don't
You're
go
right.
and seek out Dr. Folden or somebody else that's a inclusive provider. They just say, forget it, I'm not going.
Forget it. You're right.
Then they don't, they drop out of the healthcare system altogether. And then here's what we do as this organization that loves to fat shame and stigmatize our patients. Then we publish a study that says, well, look, fat people get more breast cancer. And you're like, well, you didn't control for the fact that you weight shamed them and they never came back.
Absolutely. That's the part. Mm-hmm.
Yeah, we bring them back and then we beat them over the head with the paper that says they're going to get breast cancer or whatever the thing is, and it's just, the truth is weight is a noun. It's not a verb. So it's not,
absolutely,
it's not an activity. And so, I would like, just for you mentioned a few of them a moment ago, but just for kind of clarity's sake, like if somebody that's listening to this is thinking they want to improve flexibility, reduce joint pain, increase, mobility,
mm-hmm.
these sorts of things, what are like action items?
Mm-hmm.
And spoiler alert, weight is not one of them, because you can't
do
weight. I'm doing a lot of air quotes. My fingers are getting tired of the air.
Right.
But what are some things like as a physical therapist, physical, like actual tactical things?
Yes. So first things first, always start with stretching, moving your body. And not everybody knows, like, we're not on camera for this, but not everybody understands, like, what position, what posture, but just move your body and stretch to your available range. So if that's reaching toward your toes, don't force it, don't hurt yourself, but reach and feel the range of motion you have at every joint. So try to explore it. If it's bending your head from side to side or rotating from side to side, straightening your knees, bending your knees, move your body more, get more flexible, do prolonged static stretching. If you can hold it for 30 seconds, that's awesome. You can really increase the muscle tissue that way. Finding more activities that move the joint. Sometimes when we're in pain, we have a tendency to say, like, okay, I'm just going to stop. I'm just going to protect it.
Sure.
And there's space for, lessening what you do. But in general, moving, especially when we're dealing with arthritis and things like that, moving is going to actually be better. Even though it may feel a little uncomfortable to start, getting that synovial fluid in the joints worked up is going to actually help you feel better over time. So do your best not to just stop and stay still, but move and stretch and do what you can within your available range of motion. And then, if you can, find a physical therapist or someone who practices in a HAES aligned way that can really guide you. If you need more guidance, because a lot of people do, you need to maybe understand what to do and how to do it so that you're safe. And that's really important. But, more than anything, just do your best to move and to stretch and to care for your body. You can get massages, you can give gentle self-massage, anything that feels good and take some of the load off. There's no harm in having to take pain medicine. I don't obviously prescribe it. And, I try to personally stay away, but sometimes it is indicated, and that is okay. If a little bit of pain medicine is going to help you be more mobile, go for it. There's no award given to the person who deals with the most pain for the longest. So
there's
just
not.
do it.
Oh,
There's no award.
Gee whiz. Okay. Well, that must be the trophy that is in the trophy case with the who breastfed their babies the longest.
Yes.
and who ate less than 1,200 calories for the most consecutive days. That trophy case is locked, right?
Right. Can I get in there?
Exactly. Well, I think that's good for people to hear that everybody can do something in terms of their physical body. It doesn't, I think we get this all in mentality. Like if we can't do something really dramatic, really massive, like a total overhaul, we forget to like turn our head side to side while we're sitting at a computer
Literally.
all day. Like,
Yes.
truly simple stuff. And that's what the science, back to the science is that, one of the things that helps with longevity and reduction of chronic disease is not sedentary. And
Yes.
that's all it is not sedentary. It doesn't say you have to do CrossFit at 4 a.m. It doesn't say you have to bench press 300 pounds. It just says, like, don't be completely still.
Sedentary. Yeah, absolutely. Our bodies were made to move. So move them in whatever way brings you joy. Like, I love that that app, Join, JOYN.
Oh, I don't
because
even
they
know that.
literally,
Okay.
oh, it's so cool. It's free. And they have workouts that are like 5 minutes. They have workouts that are like 35 minutes. They have sitting options. They have standing options. They have people teaching classes that have normal, natural, regular, schmegular bodies.
Hey,
And
that's what we
they're
need to
just,
see.
yeah. And they're just guiding you through. I've actually been doing it this last week and I love it. It's just so cool to not feel that pressure because, I've done beach body workouts and I like a lot of their programs because I like to feel strong, but it's so diet culture-y. It's so like, look like this and you are healthy. Yeah, it gets to be very like intimidating. So I recommend Join for a lot of my clients because it's a very safe space to work out. And you, like I said, you will see people that look like you, people in all different size bodies, some people sitting during the workout, some people standing, some people totally offbeat, and who cares because they're moving.
Right.
That's it.
Well, and I like the idea that, moving your body doesn't have to be a exclusive privilege,
No.
and there are ways, like you said, to do it within your means, within your time. So let's talk about that for a second here, because I know your other specialty besides moving your body is you're a busy mom and you help busy moms because let's face it, we're in the weeds. All right.
We are.
We're in the weeds. So how do you work with families and busy moms, and what's your sort of best advice to keep them from going crazy under the influence of diet culture? Because we are confronted at every turn.
We really are. And it's so hard because that brings in, another subsidiary of diet culture. And that's this snapback culture, this idea that, oh, you look so beautiful growing this baby. Oh, look at your belly. And then the baby's out and you're like, oh, when you going to lose all that fat? Or when you going to lose all that weight? When you going to
get like, your body back, right?
Yes. Like, wait, what?
Body? The body never went anywhere.
Still here. Yeah. So it's hard for moms. And then I think COVID, did a number on us trying to manage and maintain our own lives, and then, homeschooling kids. It was just a lot. So my coaching really picked up, during the pandemic and beyond. But I try to help moms recenter and refocus and unlearn. And if I'm being very honest, I am really just, in my opinion, reteaching all the things I've been learning in the last 2 years myself.
Sure.
As far as intuitively eating, joyful movement, recognizing the beauty of body diversity, respecting yourself, guiding them from like body negativity toward body neutrality and ideally body positivity. So we just, a course that I'm running now, we talk about the importance of intuitive eating and sort of the history of it. I actually suggest they read it or listen to it because it helped me so much. We talk about how to incorporate joyful movement into your life so it doesn't feel like it's this, separate thing after all the other things that you've been checking off all day. It's like, listen, sometimes exercise isn't going to be 30 minutes at the gym or even 30 minutes in front of your screen. It might be, hey, in between bathroom breaks, I'm doing a few squats, or maybe me and the kids are playing a game of hide and go seek and I'm chasing them a little bit. Like, I'm moving and being active, but it's not like this. Let me get my weights. Let me get my bands. Let me get my gym bag. Sometimes moms don't have time or energy or the bandwidth for all of that. So I'm just here to help them be creative in how they get their movement in, help them get a little bit more organized, because for me, that's one of my other specialties is organization has helped me not lose my mind, setting aside a little time on a Saturday or Sunday to kind of get some stuff in order for the week makes it to where I'm not completely exhausted and ready to pass out. And sometimes those days come because, life.
Right. And that's the thing is the stress that we are all under. And it's compounded between motherhood and this diet culture, and then we have COVID, and then we have this. There's always something. And the human body, back to the nerdy science stuff, like is designed to deal with periods of acute stress.
Yes.
But that's supposed to be intermittent. It's not supposed to be continuous. And that's when our health really starts to fall apart, is this
absolutely
day after day after day of just burning the candle at both ends and thinking there's some sort of prize for doing the most. And our health suffers, our physical and our mental and emotional health, I think really suffers. And so I like that you, kind of give them permission to do what's realistic.
Absolutely. Well, that's the only thing that's going to be lasting, right? If, we do this, like, let's go hard or go home, like nobody sustains that.
I'm going home.
Yeah, I'm definitely going home. Knowing what I know now, I'm going home. There was a time when I'm like, we're going to go hard. And then I've been very disappointed at the results and the way I feel later. So you're right. I'm going home. And I just don't want my mom's like feeling that pressure. There's enough going on. Like, we don't need that extra pressure of like, I need to look like this. I have to lose this weight. And that's usually what they come to me for before. Initially, it's like, I got to lose this weight. I feel so unhealthy. And then it's like, okay, well, let's unpack that.
Well, of course. Yeah. People ask me all the time. They're like, how do you have all these clients that don't care about their weight? And they want to, I said, listen, there is nobody sending me a direct message that says, I'm really interested in healing my internalized weight stigma. Like, no,
right.
They want to wear a swimsuit on the cruise and they want to know how to do it. And I said, okay, I know why you're saying that. We got to dig a little deeper,
Yes.
Well, and so interestingly, you mentioned intuitive eating, and that's a whole other conversation, but that does feel sometimes out of reach for moms who are preparing food for a family with lots of different taste preferences, lots of different people being hungry at different times, the food, meal prep, the shopping. Is it possible to have a family of intuitive eaters? Like, and what's, how do we get there? Just maybe the entry level point of entry, for people that think it's not even possible.
Yeah, it's totally possible, but it is not. I'll just say the journey is not a straight line. It's not like, oh, do this and then step 2, do this, and now everyone is. It's like, no. You have to navigate, and that's my entire program is about navigating it like the way that works for you and your family. It's not going to be the same as me and my family. I don't have the pickiest eaters. One of my kids is kind of picky, but in general, my kids will try anything for the most part. So some level of intuitive eating was, less difficult than others. I would say the biggest thing for me was starting to unlearn things. So I usually start there, is this idea that like, you got to clean your plate. Like, that's what we started telling our kids from get-go, clean your plate. And it's like, we deal with that later. We stop trusting our own bodies to tell us when we're hungry and when we're full, eating on this schedule. So I really just try to
holding the dessert hostage, right? That's what
holding
we do.
The dessert. Oh yeah,
hostage.
Yeah.
If you eat, you can't have this brownie till you eat 3 more bites of broccoli. That whole thing, right?
And it's so hard because it's how we were raised and it's the norm. And we think we're doing what's like, nobody's doing this like trying to be a bad parent. We think we're doing what's best for our kids so that they're healthy, but it's like in the long term, it doesn't help. So we like to unpack that and talk through that and kind of see where they are. So, but it's very possible. It's just a series of letting go of things that you used to do, exploring more options, like, let's just give this kid a plate with a vegetable, some meat, I don't know, some rice or potato, and then something sweet, and just give it to them and see how they do. Like, see what happens. Every mom is scared, like they're going to eat the freaking sweets first.
Well, and they might, but like, sort of, so what? The answer is, so what?
Okay, you're right. And I'm like a type A kind of organized, very like specific mom. So for me personally, letting go of that and saying, so what? Is like, ooh, what?
That's a little uncomfortable. Yeah, exactly.
It's like I start sweating and stuff. I don't know. So yeah, that part, working through it myself and then helping my moms work through that has been very fun. That's sort of where we start, but it's absolutely possible. You just have to work at it, and it's a day in and day out thing, but you'll get there and you'll get in the rhythm.
Exactly. And the truth is the kids are frequently much closer to intuitive eating than we are.
Absolutely.
Because that's how we all started as humans before we
Mm-hmm.
became brainwashed by, Slim Fast and Suzanne Summers and
Weight
Richard
Watchers.
Simmons, Weight Watchers, all the things back from the day, but that's the truth, is that if you ever look at a toddler eating or a newborn baby breastfeeding, that's like really the quintessential intuitive eater. They eat when they're hungry. Mm-hmm. They don't eat when they're not hungry, and they don't think about it for a split second after it's over.
Nope, it's done.
That's what we kind of need to be in that headspace, and letting the kids lead us, and not, sort of micro. And I'm a pediatrician, I that, and it's, I think we spend so much time trying to like micromanage the health of our children because we just want to do the absolute best, perfect thing.
We do.
The truth is the human body is way smarter than any pediatrician, than any doctor, than any mother. Yep. And if we just let it work, generally with some very, very loose guardrails, like it generally works.
Yeah, you're right. And I think about that, even taking a page out of kids' books with like body size. You know what I mean? Like I had one kid who was a big old chubby toddler, one kid who was very thin. And I remember as a mom thinking like, am I not feeding her enough? What's wrong? What did I do? And it's like, no, like they're okay. Like,
yeah, they're okay.
They're doing what they're supposed to do. And for whatever reason, adults can't grasp that. It's like, we all need to be this size. And it's like, no, we don't. There are going to be fat people. There are going to be large people. There are going to be small people. There are going to be wide people. We're supposed to vary in size. And that's like one of the hardest things for people to understand, like that our bodies are not all supposed to be within the same realm of thinness.
Sure. Well, but it's challenging when you go to the typical doctor or pediatrician or the typical physical therapist, and you're told that there is one size.
Yeah.
And so when somebody wearing a white coat tells you there's one size, you sort of take it at face value, because
absolutely,
why would they know otherwise? And I'm not throwing the providers under the bus, because there's so much wrong with our education and our practice environment and all the things. But just to have an awareness that because somebody in a white coat says something does not make it like biblical truth.
Absolutely. Absolutely. Well, that's one good thing about these new generations. They're studying more and researching more and not taking everything at face value. So that's good. That helps me when I'm sort of introducing this alternate universe of thinking on weight and body
I know that's
size.
What it feels like sometimes, right?
It does. But at least a lot of clients, I would say like 40 and under, are very much like, oh, okay. Like they're open to the idea because they're way more like, Google's their best friend. And at least they've seen and heard of these concepts now. Whereas like a little older population, they don't necessarily even think that's a thing. They're like, kind of like, what?
Yeah, it sounds like a foreign language. It really does. But it's, the bottom line is that health can be attained, or at least worked towards, in any size body. And that is if you desire to do that. There's also no moral obligation to do that for anybody.
You're right.
Most people are interested in it. And if you're interested in it, we've got lots of ways to help you, but it should be all a drive within yourself, and not subscribing to somebody else's idea of what you should look like, how healthy you should be, how big you should be, how small you should be, whatever the deal is.
So true. Yes.
So true. Well, this has been such a great conversation. I'm going to have you back, girl, because there's so much. There is honestly just so much. And you have such a great area of expertise. I have met, I will say, more dietitians working in this space than I have.
Me too.
Doctors or physical therapists or other types of providers. And so I just always, when I see one, I latch on like a parasite.
Stop. I feel the same. Thank you.
Well, it's been great. So why don't you let my listeners know, if they want to learn more about you, find out how they can contact you, where would they find you?
So you can always visit my website, which is healthyphit.com, and that's spelled HEALTHYPHIT. And then I kind of live on Instagram, so you can find me there also at Healthy Phit. And recently I joined the Peanut app, which is an app like Clubhouse, but for moms only. And I have just found it to be amazing. So you can find me on there. It's just Dr. Lisa Folden. I host chats every other Friday on things in this world, but specifically, obviously, for moms.
Awesome. Well, I will put all of those links in the show notes so you can find that. And I'm very disturbed that there's another social media app I'm going to need to.
Me too, but that's why I let go of Clubhouse.
Okay. Gotcha. So it's like Clubhouse for moms. That's very intriguing to me.
Yes.
I'm going to have to look that up. But yes, thank you again for joining us today. And I appreciate your time and your expertise.
Thank you so much for having me.
She is just a gem, and I'm so happy to have met her, because I will tell you that is one of those sticking points that doctors really have is, they can't get over the idea that patients with joint pain, with mobility issues, can be handled in any other way besides promoting weight loss. So I'm really, I learned a lot from her, and I hope you did as well. I will have all her contact information, like I said, in the show notes if you want to get a hold of Dr. Folden or find out about any of her programs or follow her content. So just a reminder, we have new episodes every Wednesday, and if you are enjoying this podcast, I would be grateful if you left a rating and review, because it gets the podcast into the ears of the people that need to hear it most. And I will continue to have solo episodes and great guest episodes. I have several coming up this fall that are outstanding. You're going to want to stick around. So go ahead and subscribe while you're there on your podcast player, and we will talk soon. Until next time. Thank you so much for being here today. If you love what you've learned, follow me on social media at Maggie Landis MD, and you'll never miss a thing. You can also check out my website at maggielandismd.com and sign up to be part of our community of eaters. Thanks again for stopping by. We'll talk again soon.